So good morning, good afternoon. Thank you so much for joining us. We're delighted that you can be here. My name is Sitka Hiscox of Tufts University, and I'm the project manager for the Incorporating Research into Practice project, which is behind this webinar series. Today, I'll be moderating the discussion. We will first start with introductions of our panelists. Then I will give you a very brief overview of the project. And that will be followed by short presentations by each of our panelists on the existing research gaps in humanitarian WASH. And we'll have lots of time for discussion at the end. So please type your questions into the Q&A while we're presenting, and then we will get back to them after the presentations are finished. So let's start with the introductions. Lauren, can you please go first?
Good morning, good afternoon, everybody. I'm Lauren DeMello-Guyett, an assistant professor at the London School of Hygiene and Tropical Medicine. Nice to be here today.
Danielle.
Hi, everyone. Good morning, good afternoon. Thanks so much for being here. I'm a professor at Tufts University, and it's nice to be here today. Thank you.
Fantastic. And Tracy.
Good morning and good afternoon, everyone. I'm Tracy Wise, Senior WASH Advisor with USAID's Bureau for Humanitarian Assistance.
Thank you. Thank you all for being here to present. So now we'll move on to just a very short presentation of the Incorporating Research into Practice project, and before we get to the presentations. So in recent years, there's been a concerted effort by donors, researchers, agencies, and implementers to conduct WASH research and innovate in humanitarian response research. And currently there's an unmet need to identify and fill the remaining research gaps and to incorporate research into practice. And in this space, Tufts University, with the funding from USAID's Bureau of Humanitarian Assistance and in collaboration with the Global WASH Cluster and partners and aligning with the roadmap goals, is beginning a grant to translate research to practitioners to reduce barriers to conducting WASH monitoring, evaluation, and research in humanitarian emergencies. So the grant is 2 years long, and the project consists of 4 components. That is a resource center on the GWC website, a research help desk, a webinar series, and trainings to local research partners. And I will just briefly talk about each of the components. So the resource center is actually an existing resource on the Global WASH Cluster website. And the goal is to expand and update the center to support evidence-based WASH and to improve the user experience. We plan to do this in 2 ways. One is to include easy-to-read summaries of the individual research papers and research topic areas. And 2 is to expand the resource center to include templates and tools that are critical to conducting MNE&R, such as ethical review guidelines or sample protocols. The second component is a research help desk. The research help desk will respond to inquiries on MNE&R in humanitarian WASH. It can be questions regarding anything from development and writing of grants to analysis support. The help desk is accessed by emailing globalwashcluster@unicef.org or emailing me or Danielle directly, and I will share our emails at the end. The component 3 is the webinar series. Today, webinar is the first of the series. We plan to run regular research webinars on research gaps and needs assessments with latest news on research, and also real-life examples of what it is like to conduct research in humanitarian WASH. The format will be very similar to the format you're going to see today. We'll always have a short introduction and then 3 speakers with about 10 minutes each. Lots of time discussion. We will have live captioning in French or Spanish, and then the recordings will be linked on our YouTube channel, captioned in English, French, or Spanish. And the 4th component of the project are technical support, including in-person trainings to WASH and research institutions in low and middle income countries that are or would like to be engaged in MNE&R in WASH in humanitarian response. And the support and training will cover anything from research design to preparation of manuscripts and publishing. So our ask today is that you please reach out to us if there are additional webinar topics that you would be interested in, or if you would like to present in the future editions of the webinar. Definitely email us if you would like to ask for research support, or if you would like to get involved in any other way, such as sharing your research results on the Resource Center or sharing your tools. So the contacts are below. It's either through the general GWC help desk at Global WASH Cluster at unicef.org, or my and Daniel's email. Okay, and so thank you for your attention. And now I will hand off to Lauren. Now I'll stop sharing.
Thanks very much, Jidka. Really great to be here today. So today's presentation is to present the kind of findings of the WASH in Crisis research agenda, which I hope kind of many of you on the participant list I can see kind of now have been part of, and it's been really great to kind of finally get to share with you the results. Let me just figure out how to share my screen. Brilliant. So let's go into this. I'll take off the subtitles because you've got subtitles already. Brilliant. So over the last couple of years, we've now been kind of pulling together something called the WASH, or the Water, Sanitation and Hygiene in Crisis Research Agenda. And we really want to set a research agenda up to kind of 2030 to really align the sector and what it's been doing. Now, of course, I don't need to remind many of you here on the call, but you know, the numbers of people affected by crises is really increasing year on year. Over 300 million people are currently in need, over 200 million affected by natural disasters, over 160 experiencing food security, kind of constant displacement, and you know, billions threatened by conflict and violence. And the risk of disease outbreaks is increasing. Climate change, COVID-19, kind of multitudes concurrent crises are really exacerbating these numbers. And so when we think about research, it's thinking about, why do we need research in humanitarian crises? Now, research really helps us on decision making. It helps us in the selection of effective, appropriate and efficient interventions that are good for program design and can really benefit the population. And some questions can really only be answered by conducting research in humanitarian crises. Of course, we can extrapolate from research that's been conducted in development or kind of peaceful settings, but we still need some of those key questions to be answered from crisis contexts. But again, I want to be really positive is that we have seen some incredible increases in the amount of research, especially WASH research, that's being published from crises context. We're seeing year-on-year increases over time. We're also seeing some funding that's matching that too. So we're seeing different donors and different organizations themselves self-funding WASH and crisis research. So it is increasing year-on-year. This is fantastic for the sector. So we're becoming more evidence-based overall. However, there still are many missed opportunities, and there's many opportunities in which we can learn from ongoing programming and interventions that we currently deliver across settings. And so the goal for kind of this collaboration, which is a collaboration between the London School of Hygiene and Tropical Medicine, Tufts University and the Global WASH Cluster, and funded by ELRA, was to set a research agenda for WASH in crises settings. Now, we sought to generate a consensus-based research agenda that really could steer the sector and the humanitarian crisis field for kind of roughly the next 10 years, kind of aligning what do we want to know, what do we want to investigate for the next 10 years to really improve programs as we see them now. So our objectives were to identify these areas of consensus and the research gaps that need to be prioritized, meeting both those practice and policy needs. We want to really direct donor funding towards these priorities and really align some of those together. And lastly, and really gratefully, to be part of this larger kind of translating research into practice, fostering that collaborative environment for WASH and crisis research that really facilitates a dialogue between implementers, researchers, and policymakers. So how did we do this? So many of you on this call are probably part of this process too, but it's something called the Chinry method. So it's a consultative approach, so kind of identifying different research priorities in a very transparent and consultative and comprehensive and hopefully replicable way. And you see here some examples of other sectors that have done this. So cholera did this 2 years ago in 2020. We've got nutrition sector, we've got reproductive health, child wasting, and so on and so forth. So you can see this methodology has been used by many other people too, to really align and generate those research priorities and really align where investments need to be made. So we kind of talk about this in a 10-step process, and I'm going to give you a very, very short overview here of what that process is, but it kind of explains kind of bringing the team together, how we looked at the literature, listed all those questions and came through this. So I'll go through this very shortly now. So of course, we selected a team that would help us do this, and representatives from academic environments, the Global WASH Cluster, and members of the interagency group. We reviewed extensive amounts of literature to see what were the questions that were being proposed in the current literature base, to understand what some of the gaps were and really pulling apart some of those questions. We conducted a series of interviews with many kind of NGOs, UN agencies, multilaterals, local governments, academics, and practitioners. Lots of focus groups too, with different kind of twigs to see what their agendas were, what kind of questions were coming out from them. We pulled out these questions, and this was really trying to pull out lots of questions all together. But we wanted these questions to make sense, right? To make sense for the context in which we were working. So we wanted the questions themselves to have, that they would have an impact, that they would be answerable in crisis context, they'd be relevant to crises specifically, and they could be, potential for scalability or translation or to be implemented in crisis context. The questions themselves, they could be relevant to any country or community affected by or at risk of a future crisis. So this wasn't limited to just those populations affected by crises. There was no specific area of the world that these crises were relevant to, but they were kind of global questions, so they could be relevant to the African region or to Southern or Central America. It captured a variety of research questions. These questions weren't all about health or health outcomes. It was well-being or dignity or efficacy or cost effectiveness, or even process things and coordination or inclusion. And again, we wanted to really say that this research agenda was aligned to the 2030 goals, so really that similarity to the SDGs, saying what can we get, what kind of research should we invest in for the next kind of 7 to 8 years to get really going and to kind of align those goals. But so we kind of pulled together, and I tell you, there was a lot of questions that came out, and it was fantastic to see the variety of things that people said and kind of what they wanted to be investigated. And we listed out from all of that research, from these interviews and focus groups, 932 questions. And I think you'll be thankful that we didn't ask you to rate and rank 932 questions, but we had a team of fantastic technical advisors coming from both the academic sphere, but also the implementation sphere, who helped review all of the questions, refine the language, and really pull together those that were relevant to crisis context. And we managed to get that list down to 130. Now, we asked you as the sector, and we sent this to over 1,500 individuals to get them in a big chunky survey that I was told took longer than the 1 hour I told everybody it would take, to ask you to kind of really review these questions and really think about prioritizing them. And we sent it to as many people as possible because we wanted to capture the variety of views, the variety of expertise within the sector, but also kind of perhaps the intersectoral links too. So we sent it to nutrition colleagues and health colleagues and vector control colleagues and maternal and reproductive health colleagues to really understand what was needing to be prioritized across a plethora of disciplines and ideas. All of those questions came back to us, and we did some lovely calculations that allowed us then to rank those questions and give us kind of, what were the top 20 priorities. And of course, we had some final feedback and revisions by our team of technical advisors who helped again just refine some of those language. And actually, they allowed us to knock down a couple of questions, merge questions, a couple of questions together, which left us then with 128. So that's my kind of crash course in the Chinnery method. And of course, you can ask us many more questions afterwards on how we did this. But now I want to bring us to actually the results. So of course, first was just who took part in this prioritization exercise. And so we had over 280 people, so 286 people responded to our survey, took the time to review this. Languages that they took this in, we kind of made this available in English and French and Arabic and Spanish. And so you can see that it was we had a kind of global spread of languages it was taken in. Predominantly men took our survey, but that's not surprising considering probably the demographics of humanitarian response. But all types of organizations were involved. You can see the majority were from kind of international NGOs, but we had a range of UN agencies and national NGOs and governments and academics, donors, and so on and so forth. So we think that we had a really nice kind of representative kind of viewpoint of the entire sector to understand what these priorities should be. And of course, we wanted to really understand as well where people were coming from. So actually people's region of origin, which they self-identified, the majority of people were from the African region, followed by Europe and kind of Eastern Mediterranean. But people's region of focus, and when it came to their kind of work in humanitarian crises, was again focusing on the Africa region, focusing on the Middle East or Eastern Mediterranean region, and then or some people had a more global viewpoint, so capturing where their focus may be. And then we talked about clusters, and I mentioned that we tried to make this as intersectoral as possible. We had a variety of people who identified with different clusters kind of answering some of the surveys. You'll see this doesn't add up to 100% because some organizations could self-select as many kind of clusters as they identified with. But I think that helps us understand that it was coming from not just a WASH perspective, but that kind of more multidimensional kind of viewpoint. And then we talked about experience, and we had about an average of 12 years of experience working in WASH or humanitarian programs. But we felt that people really understood kind of the questions that were being asked. But now let's jump to the questions themselves. So when we looked at the research, we really saw that the types of research that were being prioritized really focused on evaluating and optimizing the delivery of existing interventions. The majority of the top 20 really were focusing on what we have now, the current interventions that we have in our hands. There were some questions there that did focus on the development or improvement of, again, existing interventions. Or in some instances, we actually wanted to describe the current kind of associated health and well-being burden or practices or services available in crisis context. So it really focuses on that. What we want to know about is what we're doing now. Is it the right thing? How effective is it? And then what's kind of happening within our population that might need us to tweak or change some of those aspects. And I want to kind of emphasize that there is this fourth category, this category of discovery research. Now, within the top 20, there was really little to no emphasis on this kind of new interventions or new innovation or discovery research at this time, which I just think shows like a trend in the sector that people really want to understand is what we're doing now, the investments we're making now, kind of this is where we need to prioritize some of that kind of research, learning and evaluation. So I'm going to jump to the questions, and I do apologize in advance because there's 20 and they're very wordy. But we just kind of give you an overview. I'm really not going to read these through because we've only got a very short amount of time. But you can see here that we kind of collated the top 20 research questions together, and this will be published kind of in kind of a short report that will be coming out shortly. But what I want to do is jump to the kind of thematic areas itself that were prioritized. So we saw that like the kind of leading priority within this group of top 20 was really talking about evaluating and understanding the distribution of hygiene materials or non-food items. Within our second priority here, we had kind of more generalistic questions talking about improvements to the design and implementation of washing crisis programs, especially focusing on women, girls, kind of people with disabilities and older adults and the inclusion of these populations. The kind of third grouping of priorities, the third thematic area was improving access to and the use of sanitation facilities and reducing that exposure to feces within the environment in crisis context. Our fourth priority area, thematic area, was behaviour change, specific to improving hand hygiene, personal hygiene and domestic hygiene. So behaviour change, communication, hygiene promotion, so on and so forth. Our kind of fifth area was talking about the kind of improving the access to water sources and or the quantity of water from those water sources. I think a key area that's been highlighted in other research too. And then thinking about our kind of still other thematic areas that did come up but slightly less frequently. People wanted to know the burden of or the risk factors for WASH-related health and non-health outcomes. So thinking about risk factors for certain diseases or mental health outcomes or burden of certain aspects of kind of population affected by crises lives. And then we had kind of 1 to 2 questions here that did come up in the top 20, and I think it's really important to point out that we did have questions about climate change interventions and about the design of kind of water and sanitation infrastructure that would be resilient to climate change. And our last area here being WASH policy, coordination and governance, we had a key question about a research question of how to build the capacity of WASH professionals. And again, so that's been really highlighted by everyone who took this, saying it still is something that we need to do further work on. So that's kind of the thematic areas, and we will be releasing kind of the full list in detail so you can have a read through the kind of key questions there. And so now it's kind of really our call to action, and this is the start, today is the start of our dissemination process to really get this and to get everybody moving. But we're kind of calling different parts of the WASH sector together. But we want donors really to invest in research and to allocate funding within humanitarian programs to fund the research and evaluation that we think should be prioritized. For academics themselves to respond to the research needs set out by the sector so they know that they're answering those important questions and linking with implementing agencies to design the studies that are relevant and should need to be prioritized. And then to implementing agencies and the implementers themselves to really think about how to incorporate research into your program and crisis response and conducting research that's relevant to their organizations, but also now relevant to the global audience. And so just to kind of give you a highlight of where this is going to be available. So we've just releasing the results today, which is fantastic, and I'm really excited to do so. But we're going to be putting out an executive summary, so you don't have to read our very long report. But if you do want to really read our very long report, we're going to have a full report in detail, really expanding on some of those methodologies, really breaking down within a certain thematic area, what are the priorities. So if you're interested in fecal sludge management, you can find the fecal sludge management section and pull out the priorities there. We're going to be generating an interactive visualization tool, so you can see that maybe by organization there might be a slightly different ranking. So we allow that stratification of the data, so you can see this too. Perhaps regionally you might want to see what are the priorities for my region, so we hope to do that too. If I'm in the kind of LAC region compared to, Western Pacific, I might have different priorities that have been ranked, and I'd like to see what my kind of region of focus colleagues would think. So you should be able to do that too. Then of course we've got webinars, the one today in March, and we've got another one in April. And then we will be presenting the results both at the All Systems Connect conference in May, hosted by the IRC, and then of course the Emergency Environmental Health Forum in May, similarly in Budapest. And lastly, I do want to kind of say as a shout out is that we can come to your organization to present this. We're really engaged to get this out there to individual organizations to talk about this and say, how can you now kind of use this to optimize, to catalyze kind of research activities. And lastly, of course, I need to give a massive acknowledgements, and I've given you a kind of really brief overview here, but it was an incredible global response. We had, hundreds of survey respondents, lots of interviewees and our focus group discussants, technical working groups and cluster coordinators, and an incredible project team themselves and technical advisors who helped us do this. It was a really collaborative effort. And of course, we have to thank the research was commissioned and funded by ELRA's Research for Health and Humanitarian Crisis Programme. So a massive thank you. And again, if you do have any questions that are kind of pertinent and you want to ask us anything about the process or talk about this more, then please do kind of reach out and contact me via email. So again, massive thank you, and I think that's my time.
Fantastic. Thank you, Lauren. That was great. Please, everybody, if you have questions, I'm just going to repeat, type them into the Q&A, and we will take a moment to answer them at the end of the presentations. And now we're going to hand off to Danielle.
Thank you so much, everybody, for being here. And we'll have two more shorter presentations, one from me and one from Tracy, and then we'll be happy to talk about any questions that come up. I'll be presenting today on a different kind of gaps analysis, gaps in WASH and humanitarian research. It was funded by HIF, Humanitarian Innovation Fund, and it was the 2021 update. It was a really large partnership, Leeds, Cranfield, the cluster, Oxfam, HIF, and I just want to acknowledge all the people who worked on this as well. So the evidence gaps for WASH in humanitarian response, there was a report done in 2013 to identify in humanitarian WASH major challenges that require innovation, different stakeholder perspectives, and funding priorities. The Humanitarian Innovation Fund wanted to update that gaps analysis in 2021 to be broader and include gaps from people affected by crisis, responders, and the existing literature. So the team worked together to collect multiple modes of data. So direct feedback from a global survey, from focus group discussions, from case studies, as well as literature reviews that would then come together into overall conclusions. And so Oxfam led, there were 62 facilitation teams led focus group discussions. These were trained by Oxfam. Many organizations did this implementation. There were over 120 facilitators. And then an Oxfam team of 5 people really coordinated this data collection. G. McCluskey, Andy Baspel, John Allen, Lama Abdul Samad, and Simone Odang. So then we had all of this data from a global online survey, from focus group discussions with people affected by crisis and by responders across the globe, really. And we needed to develop a process for kind of extracting and categorizing the gaps that they said. And so first, what I wanted to highlight is these gaps emerged from the data. So we had all the gaps in a big Excel file, and we were figuring out how to pull them together. So we pulled them together into 5 themes: water, sanitation, hygiene, general WASH, cross-cutting, 19 major categories, similar to Lauren's themes like need hygiene items, and then 58 categories within a specific theme. And so here's one graphic that has all of our gaps in one place from our direct feedback, almost 3,000 gaps. And so you see our focus group discussions with people affected by crisis. We had about 1,000 gaps, about 150 focus groups. Our practitioner focus groups, we had about 750 gaps, 66 groups. And our global online survey, we had about 250 respondents and about 1,000, a little over 1,000 gaps. And we really saw this difference by theme. Our people affected by crisis really had gaps related to water and sanitation and needing water and sanitation. And the in blue, the online survey, the focus groups with practitioners had a lot more gaps around cross-cutting issues like training and coordination. And so we did see differences between these 3 different groups, and I'll break into those slightly in the next bit. You don't need to see all the words in the graph, just showing our people affected by crisis. We had a lot of water in blue, a lot of sanitation gaps. Our people affected by crisis were mostly women without disabilities in conflict-based humanitarian contexts, in protracted emergencies in Africa and Eastern Mediterranean regions. And really, the gaps that came out as greater than 5% were need for safe water, need for sanitation, need for items, need for solid waste disposal, and need for household behavior. And that's really about people saying the gaps were needs for basic services. There's a gap, I need more water, right? And so similar for the practitioner focus group discussions. Now this, like Lauren's, this was mostly men without disability. In conflict or outbreak humanitarian contexts, again, mostly protracted African or Eastern Mediterranean region again. And here we see need more safe water, okay, household behavior, sanitation items, but then here we start popping up with needing collaboration and need solid waste disposal. So you're starting to see a little, the water's in blue, sanitation in gray, but then cross-cutting's in dark blue, right? And WASH is in yellow, and those are popping up a bit more. And then we see our results from the global survey. So these are mostly mid-career men, humanitarian WASH sector, country level, international NGOs or the UN, multiple countries and large-scale crises. And then we see our water is actually very small, that's light blue. Sanitation is gray, that's smaller. And we really see our dark blue cross-cutting. Like those are the issues that were brought up. So what do we see is needed? What are the gaps? Collaboration, safe water coordination, qualified staffing, sanitation, collaboration with other sectors, funding. So we're seeing many more kind of how do we do this gaps. So again, this is like Lauren's, this is a big table of each of the top 10 gaps from the different pieces. I don't need you to see this all, but just looking at the top first gap, people affected by crisis and need for water supply and provision, focus group practitioners need for water supply and provision, the online survey need for collaboration and coordination, right? And so I think we really see some differences in the responders. So to sum this all together, in conclusion, we found that the people affected by crises wanted the what, the services. Responders wanted the how to provide these services. And then researchers, which I didn't talk about today for time, wanted to provide the why of we do this for health impact, really, is researchers wanted more data on health impact. And you're seeing some tensions in those. And also to echo what Lauren said, we saw almost no innovation gaps, even though this was funded by Humanitarian Innovation Fund and the focus group discussions were really set to elicit innovation gaps, we didn't really see those. So some limitations of this, these gaps identified were the needs of today, not why or the future. The gaps weren't weighted in analysis in any way. The online service was specific to the NGO delivery sector. And just say that processes and procedures like collaboration, coordination are less documented or researched than technical interventions. And To end here, I want to acknowledge the donor, Alra's Humanitarian Innovation Fund, all of the partners, Global WASH Cluster, Oxfam, Cranfield, University of Leeds, all of our focus group discussion members and our survey respondents. And then I will stop here and we can take questions later as we pull this all together. And just to say, this also has a report which has been delivered. There's been some webinars out, and the peer-reviewed manuscript is actually in my inbox waiting to be reviewed, waiting to be formatted so it can be published. So I think we've also been working on dissemination of that. So thank you so much.
Fantastic. Thank you, Danielle. Next up is Tracy Wise from BHA.
Good morning and good afternoon again, everybody. Thanks for attending. So today we're going to talk about the BHA research agenda in the context of this discussion. For those of you who have been in previous presentations on this, I did, because of the topic, we're going to focus really on the research side, but overall, this is the BHA research and capacity building agenda. So you'll see a bit on the capacity building as well. Just to quickly put everything in context in regards to BHA, the US government did put out a very exciting White House action plan on global water security in June of 2022, which recognized that a significant portion of the most vulnerable are in humanitarian settings and that we will be unable to reach SDG 6 without explicitly addressing these populations. And which is obviously we're very concerned about the numbers of people in need of humanitarian assistance, as was highlighted in the earlier presentations. But we're pretty excited that we are kind of getting some more of the high level recognition, particularly around humanitarian and needing to figure out support to that and not always be focusing purely on sustainable or development, but really pitting humanitarian into there as well. The USAID Bureau for Humanitarian Assistance is the largest humanitarian WASH donor amongst the traditional donors. You can see in fiscal year 2021, we spent $444 million specifically on WASH funding across 73 different partners with 360 awards. Which is roughly half of the funding that USAID spends on WASH across all types of topics and themes. So it's really important for us that we help the sector address the gaps and that we really have a program that is focused on the evidence base, because with the scale of the programming we're doing, we want to really be responsible and a good donor. So BHA WASH programs, I imagine the majority of you are fairly familiar with BHA WASH programs, but we are primarily response focused across 5 subsectors. That's a very comprehensive WASH, but we do also have resilience and DRR programs. We focus on addressing the public health risks. We also have the global awards that focus on the capacity of the sector. Research and surge support. Examples of these types of awards are WASHM, the German Jordanian humanitarian WASH master's degree, some research-based awards such as surface disinfection and hand washing, and things like the field support team for the cluster. The research and capacity building agenda that we developed was in recognition of that we had been increasingly funding for these global awards. It's still a fairly small amount of that overall 444 million. We're looking at maybe 1% of the budget goes to these global awards, but we had been increasingly funding. And so we did want to really try to have a strategy and an agenda that we could communicate with the community at large, with the goal of really being able to broaden our outreach and our coordination. The research agenda is focused on these global awards, and it does not it's not, while it is relevant to our response focused awards at the geographic level, that is not kind of the driving force behind those awards. So the goal of the agenda was to have a formal internal guidance document for our team to prioritize research, and for over 5 years to prioritize our research capacity building activities to overall improve the effectiveness of WASH interventions in humanitarian activities. The full document is not publicly available. You will see that there is the formal internal guidance, but we do have these sorts of presentations. You can find the slides and videos online. And we are sharing these top lines to increase coordination and inform others by sharing our top priorities. And we hope that this will also help inspire others and increase submissions of research and capacity building concepts to us and broaden our pool of research partners. So quickly looking at the methods that we did a systematic literature review. We had interviews both within our team, our WASH team. We also had interviews within the Technical and Program Quality Office of BHA. So this is where the sectoral experts sit. So looking across different sectors, things like shelter and settlements and health, and broadly looking, trying to get that input from a wider variety of viewpoints. We also had interviews with our colleagues in the US government and USAID. So over in the Bureau of Resilience and Food Security, where the USAID Center for Water sits, our Global Health Bureau, as well as CDC. We had internal WASH team discussions and activities to help narrow down all of these topics that we identified earlier in the literature review and in the interviews. And after we had really refined down into a smaller list, we had external interviews with researchers, implementers, and partners to help us validate what we had prioritized as well. And then we finally had a satellite event in the UNC Water and Health Side event back in October to share these and gather feedback. So thank you to everybody who participated, and we are pretty happy with the outcome and the participation that we had. We didn't have as large of a as input as, of course, as the other presentations that we saw today, and this is because we really did want to make sure that we had a BHA document that was really able to guide us and was small and focused enough for us to be able to really use it and wasn't too large and overwhelming. And we used things such as the gap analysis to inform. And so we did look at the research landscape, looking at what priorities of other humanitarian and USAID and other partners were, and identifying gaps and synergies. So we did lay that out and look at where the funding was available and not available as well. And the research priorities that we identified include the evidence base for humanitarian WASH interventions. So particularly looking at the NFI design and effectiveness, including kits and cash, which certainly lines up nicely with some of the CHINRI results. We also were looking at the timeliness and targeting of WASH interventions. How fast is our response? How is that impacting the needs overall, our response overall? The second research priority theme that we identified was WASH and integrated public health programming. We really want this to be with health and nutrition and agriculture partners, or sorry, not agriculture, the integrated public health programming, and specifically looking at the WASH response to outbreaks in humanitarian contexts, as well as the wasting prevention, treatment, and recovery with WASH. The third area was infrastructure interventions. We really recognize there's a lot of issues around operation and maintenance in emergencies, as well as the construction and repair interventions, and finally the fecal sludge management. And so those were all of the research priorities. I did want to also recognize that we had cross-cutting principles on resilience, localization, coordination, and integrated approaches. And you can hear about all of this in much more detail in the previous presentations that we've done. And in no particular order, here is the summary of the research and the capacity building themes that were prioritized. Again, we're really pleased to see that there was quite a bit of overlap with what was identified in the Chinri exercise. And of course, we did use the gap analysis to help inform our selection in the first place. And so that's all. Thank you, everybody. And back over to you, Danielle and Jitka.
Thank you so much, Tracy. Could you please just say if people were interested in watching a longer version of your assessment, where they can find it?
Sure, it is available both on the UNC Global Water and Health YouTube channel, and it is available through the Global WASH Cluster. Just the slides are available at the Global WASH Cluster website on the satellite events, and we can share links to both of those as well.
Fantastic. All right, thank you so much. So I think now we have time for some Q&A. We have a couple of questions in the chat. I was thinking I could just read them out, then maybe one of the panelists could answer them. Here we go. I feel like, okay, sorry. I feel like one of the questions just disappeared. I think one of the questions, oh, there we go. One of the questions from Brian Reed was, were any of the results surprising? Were topics missing that you expected to see, or topics included that you hadn't suspected? Sorry, I think maybe that might be appropriate for Lauren or Danielle. Do one of you want to answer?
Danielle, do you want to go first? Because I think you've asked and answered it partially to Brian. And then
Yeah, I can jump in first. I think from the GAP side and kind of writing this up, what it really highlighted is the importance of basic WASH, water, sanitation, getting the basics right. I think some of the stuff that we talk a lot about at the international level, like some of our reviewers were like, why didn't menstrual hygiene management pop up? And I'm like, it wasn't in the top 10 of what people said, or why didn't innovation gaps pop up? And I think this comes back to what will people say if they are asked what they need. So I'm not sure that the results were surprising. I think looking at all the results, I really want to echo what Lauren said earlier, which is a lot of this is about doing WASH better. It's not changing the fundamentals of WASH. And that's a really interesting thing to think about, and why these gaps came up that way. And is it possible to do WASH better? And how can research help us do that? And I think it is, or fundamental changes needed. And I think that's also a question that didn't come up in these results. And Lauren, do you want to, I'll hand it over.
Sure. Similarly, so I think I obviously gave a very quick overview and didn't dive into the questions within that top 20. But I think one of the surprising kind of thematic areas that also didn't come up necessarily in the Chinri exercise was a specific kind of like questions about menstrual hygiene management. And menstrual hygiene management was actually woven into many of the questions about sanitation access. And so we found when we kind of pulled out kind of sanitation access, but it was very specific for the inclusion of women and girls, of inclusion of bathing facilities, and for a kind of infrastructure that would allow, or services that would allow for kind of improved kind of menstrual hygiene management. And so that was a bit surprising to us that we didn't see kind of more questions that came up. However, when we did the regional analysis and when we did kind of stratification by organization type, that's when different priorities did come up. And so I think it's really important when we'll have a visualization tool where people will be able to self-select by type of organization, that you'll see that different organizations had very different viewpoints. And I think that's quite mirrored in the gap analysis to see those differences too. That perhaps if you were coming from an academic's perspective compared to an implementer's perspective compared to a government, there were different priorities that came in order. I think another surprising aspect of the WASH and Crisis research agenda was that probably climate change wasn't as highlighted as we expected to do. You know, it's what we're talking about, and water scarcity in particular. But I think people haven't quite articulated perhaps what the research questions are. So those didn't come through firstly in the data kind of extraction from existing research, but it didn't come through in many of our key informant interviews to the same level or extent as other areas did. And I think that's because the sector itself is still asking itself a lot of the questions, what do we need to do? So in terms of research, this hadn't been quite articulated in a way that we could pull out and really gather together. And as well, we did have many questions on this, which people could vote for. Again, they probably didn't get the kind of the attention that we thought they would expect. And then the last surprise that I think was that there's some really small WASH interventions that don't always get a lot of attention. So we had things like dead body management or vector control, which it sits between kind of health and WASH in its an area. And I think people really struggled on where they should sit in the prioritization, because these are key questions, the development of body bag technologies, or how to have, adhere for cultural beliefs in WASH responses. They are really important, but because it's not necessarily a general response which all organizations are partaking in, similar for vector control, they didn't really come up in the priorities, and they were ranked quite low, really. But I think if we'd gone perhaps to organizations that had really specialized in vector control, obviously they would have been pushed further up that agenda. So it's kind of thinking through some of those maybe ignored interventions, or things that don't always get the classic WASH response, were kind of left off the list. And then I could probably go on endlessly with like other things that were kind of missed. And one aspect is actually that we allowed our survey respondents to offer kind of areas that they thought were missing from the list of questions that we were able to generate. And so again, thinking about those questions that were coming through, things about WASH in healthcare facilities specifically, or WASH in schools, or specifics about kind of certain water treatment technologies or thresholds that needed to be met. So people themselves were coming up with research questions. So of course, I think we didn't cover everything, but I can see the sector itself was quite buzzing about the research it wants to do, and we have included this in the full report to see that list of everything that we didn't get to cover, to show that there's wider than we kind of were able to capture, I think. Thanks.
Thank you, Lauren.
Maybe I can jump in and answer Brian's second question, because he's asked whether there were gaps due to lack of knowledge by individuals rather than an absolute lack of knowledge. And so for our, as I mentioned, we did have a research and capacity building agenda. Although we focused on the research, well, we went very, very quickly over our research topics in the presentation today. Yes, Brian, we strongly feel that this is a really critical distinction, and that part of both what this project that BHA is funding, and that is hosting the webinar today, as well as the capacity building part of our agenda, is to really address that lack of knowledge. We do think that there are a lot of areas which we have the knowledge, we have the research, we know what to do. It's having that happen at the field level, making sure that knowledge is disseminated down to the people who really need to have it. So I think some of the areas that they're identified in the exercises that Danielle and Lauren have done have been highlighted on the capacity building side for BHA, because we don't necessarily feel that there needs to be a ton of research. It is more how do we make this into action? And that is part of the goal as well of this project, is how do we turn all this really good work. We've seen so many new publications, but it's a lot to keep up with. It's a lot for us at the global level to keep up with, and can really understand how that's challenging to get down to people who are trying to do implementation every day. Danielle, I see you'd like to answer as well.
No, I'm nodding my head, but I was thinking maybe I'll jump in and start a conversation around ANDS, which is a lot of research gaps have been identified in the context of limited funding. How do you think that we collectively should narrow down priorities to identify the most critical areas for research? And I just want to echo, I agree that we have a lot of research we need to translate to action. And that is, I think this grant is really exciting for that reason. And I think, and there are these research questions that pop up, and we can always say, well, we need more research. And I think for me, a prioritization exercise, or I have a couple of thoughts about that. One is research that can move to action very quickly. So what tells us what to do? And there's some comments in the Q&A about a lack of research in MENA, which is true. There's not as much WASH research in MENA. And so thinking about, okay, what's needed for action right now? And Then another thing I would say is, let me think if I can remember my thought. In terms of limited funding, prioritize things that can be answered in a research question with the donor. And I think there are some really key ones that can be answered right now in a timely manner that come up at the top of a lot of these lists. Maybe that answer wasn't so great at the end part there, but maybe I'll turn that over to Lauren to see if she has any thoughts as well.
Sure, thanks, Danielle. I think it's been a really kind of good example. What we've seen today is that we've got kind of, let's say, the WASH and Crisis research agenda, and then we've had BHA present their research agenda. And you can see some, I'm really happy about seeing that, really a lot of alignment between a lot of those research questions and thematic areas. You know, one of the kind of priorities clearly stated by Tracy at the beginning was WASH NFI distribution, right? And that's been identified within the top 20 as, you know, it's frequently come up. And, you know, that is a common kind of intervention that is employed by many agencies. So I think that alignment just between a donor and the research prioritization exercise is a way to allow us to identify the most critical areas for research funding. And similarly to what Danielle said, they are potentially easy wins as well. You go, can we do this? Can we do it well? And can, you know, we've got the funder, the implementer, and the researchers all aligned to what that is. And I think that really helps us to do so. And I think it's finding commonality between your organizations. And I kind of really want to kind of ask everybody to invite us to your organization to talk about the research agenda as well, because I think once we start speaking to kind of X, Y, or Z NGOs or UN agencies or local governments, it's aligning, saying, well, they probably have these conversations already. What's aligning to these global agendas, and what can we therefore match up, and kind of can we hit all of those and tick those off as quickly as possible, and having kind of a more participatory approach to engaging in the research, saying these are the ones that we're going to invest in now. And that's, I think, it will a way to kind of reduce that list of 20 down to kind of 5 for now in the next couple of years, and then we keep cracking away at that list, and just finding some of that alignment is really key. And I think it is really useful that we had this presentation at the same time to see, look, there is a really nice overlap. And of course, now we would want more donors to kind of go through that similar process from their side to say what aligns kind of in their kind of ideologies and their kind of program designs going forward, and then implement to do the same, academics to do the same. And I guess just to go back to reflect on Brian's question as well, and I think this is a question we really reflected on in the WASH and Crisis research agenda, is of course, with our respondents who were answering the survey, are they prioritizing a question because they don't know about the research that already exists on that question, or is it that they don't have any knowledge about that question in the first place because there isn't any research? Now, it's quite hard to tell, but what we did see, and I think that was just quite nice to see, is we know there's lots of research, for example, on point of use water treatment, and especially in emergency context. We still kept those questions in, and we asked people to prioritize them, and they weren't prioritized. So that was a really nice clue to us to say, okay, we think people are really have seen some of the research, have seen some of it. Of course, we can't measure to what extent, and that still might be a huge lack of knowledge, meaning some things were prioritized that maybe there is a larger body of research on compared to others. But I think that was at least a minor indication that perhaps this is not necessarily a lack of knowledge, or a lack of knowledge of the research, but maybe a lack of knowledge overall of how to design their programs. So we hope that the research questions that were generated are adhering to a lack of knowledge rather than just a lack of access to research. But like projects like this, and the one kind of undertaken by BHA and Tufts, is hopefully going to help bridge that gap and start to really think about how do we get this research further. And I think sometimes we get stuck in our academic sphere and we don't get dissemination out there properly, and you know, the trickle down effect, and it doesn't really happen. So I think that's going to be our biggest thing, and especially building capacity, is how do we get the research out there? How do we get it out there and be into a usable format that's not always at a manuscript or a paper and things like this? So I'll leave it there. Thanks.
And I'll jump in as well on the prioritization question. I mean, as you saw, we did try to prioritize for BHA a fairly, small sector, but at the same time, we left a lot of breadth in there. And I think we can use things like the Chinry exercise to help further inform, out of those priorities that we identified, where do we really see a lot of evidence coming, or a lot of additional questions coming through? And then we can prioritize those within the agenda, or we can refine the questions that we have within the agenda. But we don't have to undo the year of work and all of the time that we spent to develop that agenda. It just helps us further focus within it, and say that we really have kind of the weight of the humanitarian WASH sector, even without having having done as much of the work, we're able to incorporate and really utilize those results.
Yeah, and I think that a couple things to think about. One thing I also think is important is a lot of the research, and it's reflected in the people sitting here speaking, is coming from Northern institutions. And I think research to prioritize would be amazing that's at the local level. And that's also something that I know the donors and all of us are thinking about is the localization of the humanitarian research agenda. And I just wanted to highlight that I think would be a way to also prioritize filling research gaps is what can be done in the localization agenda. And I do think one of the exciting things to me about organizing this webinar and having Tracy and Lauren be able to be here is putting these three things together, because these three results really build on one another and they're building blocks. And I think they come to similar conclusions, but as Tracy said, they feed into one another and bring nuance to one another. And just to echo what Lauren said, to answer Brian's last question, which is, are there any areas perhaps we should no longer prioritize for funding? Systematic reviews, the research gaps, they all tell us that there is a lot of data on household water treatment in emergencies. And we know how to do chlorination in emergencies. If you want to get the right dosage and do some household visits and do some training, you might get some high uptake, but if you're just going to distribute chlorine tablets out, it's not going to be very high uptake, and filters need replacement parts and training, right? We have a lot of research that boils down to that. We probably don't need a lot of more research on that. And I think, as Lauren said, that's reflected, those questions didn't pop up in the CHINRE, that's reflected in the systematic reviews. They come out as quantitative questions that have been answered. And so I think that we really are thinking about the new things that are bubbling up. And that's an important thing to see across these three studies.
Great, thank you, Danielle. So we are almost at time. And so I just wanted to ask you if you had, anything else to add before we end the session?
I just wanted to say thank you, everybody, for being here. It's great to do this. This will go up on the YouTube channel, and there'll be it'll be translated into Spanish and French, and so it will be available. And then one thing to note, and feel free to type this in the Q&A, we're planning webinars for April and May. We're hoping to announce it today, but we don't have confirmation from all the speakers. We're hoping to do a CATI, a case area targeted intervention webinar in April, especially with where cholera is. And we're thinking about a menstrual hygiene management webinar. And so we're thinking about webinars into the future that will run very similarly to this. We'd also love to highlight local research as we move forward with the grant. So definitely what I'd say is feel free to email us with thoughts about webinars you'd like to see, local research you'd like to see highlighted. If you have questions, feel free to email. And I wanted to thank really wanted to thank the donors, ELRA, both the HIF side and the R2HC side, and BHA, who really allowed the pulling together of all this work on the research agenda and are thinking about how to fund it moving forward. And thank all the presenters here today.